Let me tell you, moms and dads back home, they could care less about the internal divisions. They see it as all part of CMS. They see it as one of the same. They see it as the government. And so here we are for the budget request that we've got that says the backlog is going to reach 1 million. At what point does it become a crisis? At what point? When does it become a crisis? When do you start putting companies out of business, because you already are? When does it become a crisis that you're willing to do something about? This is your document. 1 million backlog by the end of this year. So is that a crisis?
Well, sir, if there are individual companies that are being put out of business by these audits, we do have flexibility in how we
But you don't. I've already called on behalf of some of my constituents, you know, and that would be a great response, but it's not true. Because you know what? I've dealt with Jonathan Blum. I've called to make sure that Kathleen Sebelius knew about it. I've called the White House. And you know what? You say too bad. So what do I tell the moms and dads who are going to lose their job because they do not get a fair hearing? What do we tell them?
Well, sir, we are able to do what we are authorized to do. So whether it's an alternative payment arrangement or something else working with a provider,
all right, so you've got 5 years for an alternative payment arrangement. I know this stuff. I've been studying it for the last 6 months, 5 years. So if the backlog is 10 years, what do they do? What do? They just pay it? Because right now, at 1 million people, at 1 million appeals, your rate, the best rate that we've had from the adjudicators, is $79,000 a year. And even with your budget increase, that would still be a 10-year delay. That's a taking in my book. Would you wait for 10 years for your salary?
So yes or no? We do whatever we are authorized to do in terms of working with providers to try to make the system less burdensome.
All right, so how do we
can stretch out payments. We can change things in individual cases. But again, we cannot overstep the authority that has been granted to us by Congress.
But something changed. Something changed. Because you know what? The audits went from 1,500 a week to 15,000 a week. So what did you change? Because, I mean, it's in your documents. I'll be glad to give you that, too. Actually, it's worse than that. They said it went from 1,200 and change a week to 15,000 appeals a week. What did you change?
So, again, I think it's important to level set on this. It is our obligation to audit. We have improper payments that you've heard about from the other witnesses, that you've heard about from the rest of the committee. It is our obligation to go after those improper payments to try to reduce the rate and make recoveries where possible or you know, where they should be made. That is an obligation created in law. And to also level set, sir, on the amount of auditing that we do, we audit far less than 1% of all claims that we receive. In fact, all of the overpayment determinations made by RACs in the latest available data to the public account for less than 1 day of claims that come to the Medicare program.
All right. My time has expired. I would like one answer to this. The law says that they need a decision in 90 days. Is that law being violated, and who makes the choice on what laws we enforce and what laws we ignore? The law says 90 days.
I cannot comment on the processes that are outside of the jurisdiction of CMS.
But this is in your jurisdiction. I'll be glad to give you a copy.
That is at OMHA.
No, this actually talks about qualified independent contractors, which is under yours, and then the ALJ is after that, 90 days after that.